Hey guys, Justin Brock here, interrupting our regularly scheduled programming to let you know that we thrive on the follower, the subscriber, and the reviewer. Please leave us a 5-star review. Please follow the podcast. We're going to get so many guests on here. You're not going to want to miss it. And if there's anyone that you have in mind, please leave it in the review. Please leave a comment wherever you're at, YouTube, Spotify, Apple Podcasts. Those are all platforms that we are paying close attention to, so that we can get out the information that you guys want. Please let us know who you want on the podcast, and please let us know what information you'd like us to cover. Thank you so much for listening. Now back to the regularly scheduled broadcast.
Hello.
Hello, 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 hello.
What is up? Happy Friday. Happy Friday. Mic check. Everybody hear us?
Yeah, let us know if you can hear us loud and clear in the chat.
Loud and clear.
Because if you can't, we spend a lot of time not making this right. So
there you go.
All right. Yeah, so hoping that you guys hop on here and definitely want to mix it up today and get a good conversation going about Medicare, all things Medicare, the senior market. But right now we wanted to talk about Medicare Advantage and the evolution that we've seen in our own practice coming from the Medicare supplement world to now doing quite a bit of Medicare Advantage. Really want to see what you guys' feedback is on the shift to Medicare Advantage. And I know a lot of you came into the marketplace on the Medicare Advantage high anyway, but some of you out there have been around to see this evolution. So would love to get you. If you're coming in right now, please let us know where you're watching from. And look at that, Benji Crooms and Will Chapman
Benji?
on here.
Out of Medgar, Georgia.
Sup, little Benji. Man, Benji, man. What a great guy.
I love Benji.
We love Benji. Everybody over here loves Benji. We're big Benji fans. Benji, let us know where you're watching from. Medgar, Georgia, right?
Yes.
Or are you on vacation somewhere, taking a post-AEP vacation? Georgia. That's right.
Georgia.
Yeah, them Bulldogs didn't have a bite, did they? Not over the Tide.
I was disappointed. I was hoping I'm always thrilled to see Alabama lose. So
yeah.
I was disappointed. But maybe in the national championship, Georgia and Alabama come back, play each other.
Georgia can.
And they get the revenge.
Georgia can still pull it off.
Kirk Herbstreit predicted that this would happen. So
yeah,
maybe he's right on point.
I'm still thinking Michigan's going to take out Georgia.
Michigan, yeah. Coach Harbaugh runs a tough team, so
yeah,
very, very, very well possible.
Well, we'll see. Let's don't discuss that. All right. Hey, Will or Sed, if you could share the live stream over into Medicare Gurus, that'd be great.
As well as the viewers, if you're listening, share the stream.
Yep. Share the stream to your Facebook page. Let's get some people on here. The more, the merrier. So this year, and if you could pull up that in the text group, that diagram of how many apps our internal team wrote. So we were breaking down our internal team application mix, and just wanted to share something with you guys. 3 years ago, we probably wrote internally an average of maybe 5 Medicare Advantage plans a year per agent, right? And I think if I pull it up here.
This one right here.
Yeah, and we don't have to share it or anything. I just wanted to have a reference from the numbers to show like our Medicare Advantage application count. So just to show you guys a little bit of the difference here is we were probably, I'd say when you came on board, Stephen, we probably were still at 5 Medicare Advantage, 10 maybe Medicare Advantage apps a year per agent.
Yeah, it wasn't really a thing at all.
Yeah,
my first AEP.
So just give you guys a little bit of an example. This, looking at this year, Holt had 124 Medicare supplements and 89 Medicare Advantage plans. Jackson Taylor had 324 Medicare supplements, 121 Medicare Advantage plans. Johnny had 110 Medicare supplements and 246 Medicare Advantage plans. He was the only inverted agent, I believe. No, Stark was too. Mike, 151 Medicare supplements and 51 Medicare Advantage plans.
First year guy.
First year guy. Rob, 166 med sups, 91 Medicare Advantage plans. Stark, 165 Medicare supplements, 192 Medicare Advantage plans. Zach was 70 med sups and 25 Medicare Advantage plans. And it goes down from there. Bill, 68 med sups, 7 Advantage plans. Me and Steven were in we only wrote about 40 or 50 med plan apps for the fall, but even we were writing some Medicare Advantage. So anyway, when you look at the difference for us, it's been huge. We've had this huge shift. And so why is that? I mean, there's so many reasons that we see Medicare Advantage expansion happening, and a lot of it is people that we couldn't write before, dual eligible people, Medicare, Medicaid. That's been a part of it. Right, that was probably one of the first segments we really started to write. It's not really a huge portion of our turning 65 business, I'll tell you that. The majority of our turning 65 business, we're still seeing MedSup, unless they're dual eligible, and then occasionally we get some premium averse people that lean Medicare Advantage. But for us, majority, I'd say 98% of our turning 65 is still MedSup. 99.9 when you remove the dual eligibles from it. When we really break it down, though, we have seen a huge transition for Medicare supplement people swapping to Medicare Advantage. Yes. I'd say that's probably, if I break it down into sections, that's probably one of our biggest. Now, for us, we had a huge Medicare supplement book. Now, we're not calling these guys up and saying, you should change to Medicare Advantage. But they're seeing it, they're asking about it, and then when we break down the difference when they start asking about it, we're just seeing some of these people that are tired of paying $250, $220.
I would say it's 50-50. Some of them, you explain it to them, and you really break it down, and they say, yeah, it still sounds good, and they want to go with it. And then some of them say, no, I'll like the predictable cost, and I want to keep paying my supplement premium.
Yeah, I want to go to any doctor I can, anytime, that kind of thing. Yeah, so that's been a big part of it. Medicare Advantage swappers is becoming a little bit of it. One of the cool things, though, is we've had a really high true-up rate because in our geographic area, the Medicare Advantage expansion is kind of new, and so we don't have a lot of the swappers right now. A lot of ours are new to Medicare Advantage. They're coming off of MedSup. They're coming off of just having traditional Medicare alone. So not as many of them swapping.
But I think it was surprising about how many people that we put on Advantage plans to start 2021 that we, talked to during AEP that were happy with it.
Yeah.
And they just keep what they got. My grandmother being one of them. Yeah. She was very pleased with her Advantage plan that we put her on, and I asked her if she want to make any changes. Actually, she called me because she's seen the commercials. I thought it was funny. It's like, even you, Grandma?
Yeah.
even you're curious? And so we reviewed it. We looked at it, and I told her, yeah, your plan's only getting better, so just keep it. And she was happy with that.
Yeah. With Medicare, I've seen people before say that they have a high percentage of people calling with Medicare Advantage to get on Medicare supplements. I think that's isolated concepts based on lead source. So if somebody's lead source is YouTube videos that talk bad about Medicare Advantage all day long, then of course they're probably going to have a disproportionate amount of people finding them to get off of Medicare Advantage. And they're finding the anomalies of the people that are really dissatisfied with it. I hate to be pro or against Medicare Advantage or Medicare supplements, but what we're seeing is an extremely high percentage of our Medicare Advantage enrollees are completely satisfied year after year after year, even ones that are having decent claims.
Yeah.
Now, we've sold a really high attachment rate of hospital indemnity and critical illness insurance with our Medicare Advantage plans. One of those reasons is you're taking people off of a $200+ a month Medicare supplement. It's easy to use 100 of that to sell some ancillary benefits to protect them against some of that out-of-pocket potential.
That attachment rate was awesome. I mean, just take Justin Stark, for example. Wrote 192 MAPDs, wrote 162 hospital indemnity plans.
Yeah.
I mean, what is that attachment rate? That's
huge.
80-90%.
Yeah. And then wrote 124 cancer, heart attack, and stroke policies. Yeah. So that, and some of those were probably more with MedSup as well. but still, when you break down, this is one time I was in Jagger Esch's office, and he's got a very sophisticated system, and he was showing in real time the ancillary attachment rate per agent, and there was an agent that had over 100% attachment rate on there, and at the time I didn't really understand how that was possible, but now we have that. If you break down number of ancillary applications to number of health plans, we have agents that are over 100% attachment rate based on the high number. That doesn't mean every single person they're talking to, they sell an ancillary policy, but they're selling either so many ancillary policies, or they're selling such a high number of ancillary policies, or they're selling ancillary policies even when they can't get the health plan,
right,
that it makes them have over 100% attachment rate. And Holt rushing, probably as far as ancillary goes, is crazy because he was a newer agent. He started in June for us. And
started June 1st was his first day in the office. And
he had 80 hospital. Wait, no, I'm reading the wrong one. He had 51 hospital indemnities, 217 cancer, heart attack, and stroke policies. So that's crazy. 112.
Take this.
Oh, wrong soundboard.
It's the wrong soundboard sample. He had 112 dental, vision, and hearing policies. So that is nuts. He had a crazy, crazy high amount of ancillary policies. There we go.
I had to give him a round of applause.
You got to give a round of applause for Holt. So, when you're talking to people, it's not just Medicare Advantage. Unfortunately, so many new agents come in and they think, if I can't sell them a Medicare Advantage plan, or if I can't sell them a Medicare supplement, based on where they came
Rolando makes a good point, too. I mean, like, we're talking about our market where Medicare Advantage is a brand new product, and so a lot of people are just getting introduced. But if you're Rolando's in California, and he said about 90% of the people that he speaks with are leaning towards Medicare Advantage. They want the Medicare Advantage plans. I mean, there's markets that we've heard of, Las Vegas, Florida. Some of these markets are inundated with Medicare Advantage plans, and the companies are competing so bad and throwing so much benefits out there.
Yeah.
It's ridiculous. I mean, maximum out of pocket's like $3,600.
Yeah, we've seen some in like Vegas with MOOPs at 1,000.
Well, it's hard to sell a med sup against that.
Yeah.
I mean, when you're paying that much in premium,
very little out of pocket. I mean, you'd really have to harp on prior authorization, which, to be honest, guys, I would say in the next couple of years you're not going to have that much of an issue out of it. It seems to be getting.
I think providers are more and more getting hip to the Medicare Advantage and understanding how exactly it works. I think in the beginning there was just so much confusion with it.
Yeah. And that's coming from people in Mississippi. Like, we're probably one of the ground zero states for Medicare Advantage, like being anti-Medicare Advantage for a long time. The more rural states you get in. I was just talking to Josh Lustig. He's in Idaho. Idaho would probably be a similar, concept based on rural demographics and not having as much hospital competition. You get into bigger cities, you have all these hospitals competing, and so they have to take plans because they're competing with other hospitals. And if they say, we're not going to take any of those, okay, then you're going to lose all your patients to the hospitals next door. But here, in Tupelo, we have one big hospital, and then, you have to go a decent ways away to get to the next biggest, would be Baptist Memorial. And so we've had some of that where we've had like North Mississippi Medical Center kind of boycotting Humana for a while. And it caused us to have a lot of business, but some of that business early on was hard to help because Humana at one time was the only Medicare Advantage plan in the area. People were coming in to get off of Humana because the hospital wouldn't take it, but they, and sometimes we could get them on a Medicare supplement. But even then, when they were used to paying zero, or paying for that Medicare Advantage plan, it was so difficult for them to put something on bank draft.
And I think Humana unfairly got a bad rap. It's nothing that they did wrong. It wasn't that, they were out of line. They were abiding by the rules of Medicare Advantage and providing it that way. It's just, again, the providers were unfamiliar with it at the time. Yeah. And so they were telling clients that it was bad.
Yeah, a lot of times we see, and this is, I don't want to, talk bad about billing staff or anything, but sometimes it's billing staff being extremely used to seeing original Medicare only and Medicare with Medicare supplements. And so they file a bill, everything's paid, and they really don't get any kind of flack. Well, why do they not get any flack? Okay, well, it's taxpayer funded. It's not. There's no company there that's trying to protect their profit margin from fraud, waste, and abuse. It's fake money. It's like monopoly money. So I think sometimes they just throw it at it. They don't really claim it. So an insurance company is going to look at something to make sure it's not fraud, waste, and abuse. Now, can sometimes that be egregious? Yes. Can sometimes they get convicted of fraud themselves because they're overcharging the government for things on the back end, like where if they diagnose enough stuff, they get a higher reimbursement rate from Medicare? Yeah, that definitely happens. Private companies are not immune to doing things that are fraudulent as well. But I'm kind of the mind that the government is the worst at spending money because they don't actually have to create it.
You mean there's Medicare fraud? That things exist? Unfortunately.
Yeah, unfortunately, there's Medicare fraud. But thankfully, I think there's a pretty big microscope on these companies, and from regulatory burden. But there's enough money going into it that I think that they're working it out, and it's getting better and better.
Yeah,
which is good for the consumer. It's good for the agent to be able to sell both. Now, this is an interesting thing, though. Like I was talking to, like Taylor Brown's in here today, one of our agents from Indiana, and he came up on selling Medicare Advantage, and he just can't sell Medicare supplements. He just doesn't know how to do it. He's never been trained on it, which I always find interesting because Medicare supplements seem to be one of the easier things to sell to me. Okay. They're light plans. They're super standardized. They attach to your Medicare. Everything's covered. Everything's covered under certain ones. Very little out of pocket when you're looking at Plan F, Plan G, Plan N. And they just never been trained on it. And he's in a state, Indiana, where there is a ton of MedSup, ton of it up there. So, and I think it's just not being trained to ask for it, to look for it, or when they see it, being scared and just not understanding it. We actually we got one of those unsolicited Pakistani calls that I let transfer me as a fictitious Medicare beneficiary.
I like to have fun with them.
And I was talking to the girl and told her I had a Mutual of Omaha Plan F. And she said, well, what does your Plan F cover?
Yeah, she was asking questions about it. She
didn't know what the Plan F was.
She had no idea.
She just she kept telling me I needed a PPO. I needed a Medicare Advantage plan with additional benefits.
She wanted a Medicare Advantage sale.
I was pretty sad that they have people like that on the phone. Unfortunately, that does exist. But, that's in any industry. There's, bad real estate agents. There's bad carpenters, construction workers. There's bad everything,
Well, and the thing about it is we're in an industry where you don't have to be that way. Just educate them and let them decide. Whatever they decide to do, I mean, you're going to profit on. And I thought it was telling. Jason Dennison shared it was either a 6 or a 7 year chart the other day of like what the commission was after 6 years or 7 years. I can't remember, one of the two. But considering true ups and then renewals on the MAPD and saying they kept it for 6 years versus MedSup with the PDP, and the commissions were like right there neck and neck, with how much you actually made. So it shouldn't bother you, which way they go. You just need to be prepared to handle whichever way they decide to go.
Medicare Advantage is just easier to sell. It's really easy to instantly convince somebody that they can have something that costs nothing.
Again, are you selling anything?
Yeah, you're not. If you don't sell them an ancillary policy and you just enroll them in a zero premium Medicare Advantage plan, you're not really a salesperson.
You didn't sell anything.
Yeah, you're just like a glorified enroller. You might as well work for like the Census Bureau or something. But don't say you work for the Census Bureau to get in the house like one agent that we heard of did.
That might get you in a little bit of trouble.
Yeah. So if you're watching this, guys, please put in the chat where you're watching from. Let us know what questions you have, what you've seen, out in the marketplace with Medicare Advantage, Medicare Supplement, what questions you have about selling each. And just let you know, I had a great chat with my friend Nick Micheletti over at Heartland National yesterday. And want to give a shout out to Heartland National. We did a tremendous amount of business with them and their hospital indemnity
most of them hospital indemnity plans we mentioned were Heartland National hospital indemnity plans.
Yeah, and that company has done a great job for us on hospital indemnity. Aetna as well. We did write some Aetna. We had a lot of our cancer, heart attack, and stroke with with Aetna. So I want to give a real shout out to our carrier partners. I've been around long enough to see when a carrier does not prepare to handle the influx from AEP. And I will say the carriers that we chose to do the most business with this year did an outstanding job. Even some of the ones in the past that haven't or have had hiccups, they did a great job. They seem to have plenty of staff, plenty of training to get the applications to go through in a timely manner. I think a lot of people deserve a lot of credit this year from being Johnny on the spot. I'm assuming this is a record year for applications submitted for a lot of companies, and so Aetna, Heartland National, with Medicare Advantage companies, Humana, United Healthcare, Aetna. We got a lot of support from Aetna's Medicare Advantage side this year. We had some small hiccups, but we had a lot of people coming from all over pulling together to fix things. We always expect there's going to be some hiccup with the volume that we're doing, but
I mean, working with our local broker managers for them carriers was huge. And
very big.
Still big. I mean, we're still doing it, planning for next year already.
Yeah. Give a little shout out to Manhattan Life. Chris Kuhn from over
Manhattan
there
Life
had called us earlier just to reach out to see what we wanted. So really appreciate. We can't do what we do without carrier support and those guys doing that. So I'm not trying to lead
Manhattan
anybody
Life
off
has
that
some
list.
really good rates on their MedSup premium.
Yeah, the Medicare supplement premium was good. The dental vision hearing policy is good. Cigna's dental vision and hearing has been something we've been writing a lot of. So these are unpaid endorsements, just telling you guys what we're seeing and wanting,
Right.
if any of those guys are watching, wanting to know, we really appreciate all they've done this year.
Yeah. I mean, because we vet out our products. We look at them, and we honestly want to put our clients on something that you would have on yourself.
Yeah. And often do have those policies on ourselves or our family members.
I have the Manhattan DVH on me and my wife.
I do too. And the Cigna DVH is really good. It wasn't around when I took out the Manhattan one, but the Cigna one is really good as well. There's some great products out there. What's funny is there's products now that I'm like, oh, that's definitely not the best product out for that. But then when I look at it compared to 5 years ago, that product's better than anything that was out 5 years ago.
Yeah.
So the companies are adapting. They're really bringing the lightning and the thunder when it comes to benefits and deliverables. And so if you're writing a company that's not doing that, just know it's not the norm. There are some great companies out there that are submitting high volume business and doing a great job at it, paying claims well and putting out fires well, and not going out and rescinding policies and goofy stuff for goofy reasons, trying to screw over people. We do see a little bit of that in the under 65 market, by the way. That's one reason we've started writing a lot of ACA is, and this is there's a time and a place for things like short-term medical. Unfortunately, the short-term medical, sometimes we see it pushed into scenarios that maybe it didn't fit, and we've seen a lot of issues with it.
It's hard to write short-term medical when there's a year-round SEP.
Year-round ACA SEPs and extended CARES Act subsidies.
Because a lot of the times, when people came to you in that situation, middle of the year, March, April, you would write them a short-term medical to get over to the open enrollment period, come back and review their policy in November.
Mm-hmm.
You just didn't have a lot of that this year because, like I said, you go and look at the ACA, and then with the increase in the Rescue Act and subsidy, it gave everybody more of a subsidy. So people that may not have got any started getting a little bit, or if they were getting a little bit, they got even more.
Yeah.
So it made it harder to write the short-term medical this year, for sure. I think our numbers were probably a little bit down this year on short-term medical, but our ACA numbers went drastically up.
Yeah, ACA was we had a huge ACA year, and now because through January 15th we have this ACA opportunity, we're trying to review as many of those as possible. Yeah,
I was just talking about this the other day, where typically after AEP you only have 8 days to sell, or really to focus on that, under 65 ACA market. If you're a true Medicare agent, right, you kind of put that on the back burner. But this year's a little bit different, where you have a whole month and a half after AEP. That's giving you almost an entire enrollment period in years past. So it's like you didn't miss anything. You just went from Medicare enrollment period to a ACA enrollment period. So
yeah,
it's a huge opportunity. If you're not capitalizing on it, you already have a health license.
Yeah.
I mean,
Yep, and we're
a no-brainer.
We actively are now, and we've avoided it in the past from an FMO perspective. We were more of a MedSup, Medicare Advantage focused ancillary health FMO, but as far as recruiting now, we are recruiting for ACA because we've finally found a partner that makes it easy.
Yep,
So.
I was gonna say we finally found somebody to partner with. It's been a
the contracting side of ACA has been crazy, but we finally found a partner where we can bring that on, and so. Definitely, if you're looking to get into it, now's the time. Hopefully you can get appointed quick enough. And, I mean, who knows? I'm not saying this will happen, but it's certainly possible with continuous variants that they keep announcing or whatever, that they will extend, a special enrollment period.
I said
again.
it the other day. I thought Joe Biden, it'll be the same way all of next year. I don't think there will be any end to it. I think there will be some SEP that opens up just because, I mean, they're starting to lock down some states again. These mandates are coming down, and I think that will just be another excuse to extend the SEP.
Yeah, yep. Which I won't get into whether I agree with all that, but I will say that if it creates an SEP, that's an opportunity for us, and so we will use any opportunity and tool we can to help our clients, because that's my job, is to help them navigate the system the best we can.
Well, it's not, even we had a hurricane back in August, and now in Mississippi, the entire state has an SEP still for Medicare.
Yeah. So we're under a full to December 31st FEMA SEP, and all the carriers are telling us we can continue to submit business. So, SEP. But by the way, if you came into Medicare in the last year or two, the SEP craziness that wasn't a thing, and OEP like. The first year OEP came back, it also seemed like they just started extending it SEP. And it just makes me wonder if there's not going to be a point where it's just year-round open enrollment. Can I throw this out there?
Can we lobby for CMS to change it back to the Medicare Advantage disenrollment period?
I would prefer that.
It was appropriately named. There was no reason to change the name of that to OEP. I think that's just more confusing.
The big thing was allowing MA to MA swaps, like plan changes. But it just creates an additional AEP. It
does. It extends it.
The only difference is, I guess, is that the feeding frenzy hasn't shifted, but I think there's a time coming from continuous advertising through OEP that even the frenzy is going to continue to that period. Now, if it gets to be a long enough period, maybe the frenzy is slowed down because people start to feel like, I can kind of enroll anytime because there's all these enrollment periods.
Right. They're going to say, well, my neighbor Betty just changed her plan, in March.
Yeah, which might be
they're talking to you in April.
Might be a good thing because I know a lot of agents that hate AEP because it's a tremendous opportunity for a new agent, but if somebody's been in it a while, it's
a little overwhelming.
Yeah, and they're having to. We look at it as a huge opportunity still, even though we have a lot of service work. We just try to, get the service work to be as streamlined as possible. So Rolando brought up Medicare Con when he was logging off. Really hope to see all of you at Medicare Con. MedicareCon.com. There are some potential discounts available if you reach out to our office. You can go to MedicareCon.com.
April 21st, 22nd, 23rd. If you got plans, cancel them. Kyle Cocut, I know you got a wedding plan. Cancel it.
Cancel the wedding.
Wedding
in April. It's going to be raining.
Terrible
April showers. Timing. Bring May flowers. What are you doing?
Terrible timing.
But Medicare Con is going to be really good this year. We just secured our headline platinum sponsor. We're going to be going out to the event or to the site to do some more planning in January. And you can reach out to Will at mcgurus.com. You can reach out to Johnny at mcgurus.com, or you can reach out to Zach, Z-A-C-K, at msgap.net. I know we had to make that confusing. msgap.net, Zach. Or you can give us a call, 662-844-3300, and just ask for a Medicare Con ticket, and you can get on the phone with one of those guys, and we can definitely there are some small discounts off of those tickets if you talk to the right person right now. So definitely call in, definitely reach out to one of those guys. And just so you guys know, behind the agency February will be
it's probably going to be the biggest one we've had yet.
It's gonna be the biggest one. We're gonna do. We're looking to have 20 to 25 people, where it's normally been 15. We are bringing in somebody special. We have a very special guest coming in, and his name is Josh Lustig. So that's
big announcement. Big announcement. Josh Lustig will be at our February Behind the Agency event.
Yes, and he'll be in Tupelo. It's going to be awesome. It's going to be a two-day full immersion, learning all of our stuff, learning the way we do payroll, building an LOA team. We're learning the technology and marketing, all of our internal sales scripting and sales process from me, Stephen, Rob Sevilla, and Josh Lustig this time. It's going to be great.
And same thing on that. If you want more information on the Behind the Agency events, reach out. Same phone number, same people, Johnny, Zach, Will, all of us.
If you just wanted to go and check out yourself, you can go to MedicareCon.com for MedicareCon, or you can go over to BobbyBrockInsurance.com/agents/BTA for Behind the Agency.
Yeah. Said, have we got a testimonial video on the YouTube channel of people from Behind the Agency?
I think we do.
We do? Yeah.
Yeah.
Search the YouTube channel for Behind the Agency. There's some guys that have been to the events.
Search Justin Brock Behind the Agency. It should come up in YouTube. And that's another thing, something we're learning. You know, we were kind of suspicious of this before, but we're not sharing a lot of our YouTube video links in Medicare Guru's Facebook group or on social media platforms directly anymore because it seems to suppress our results in YouTube. So if you are, wanting to get the most content like this, where we're actually long form talking and help us by engaging, you need to go and subscribe to our YouTube channel. As well as when you're looking for something, search for us.
Most importantly, hit that notification bell so when we go live like this, you get your notification. Justin Brock is live. Yeah. You can immediately tune in.
Search for Justin Brock Medicare in there, Justin Brock Insurance. Any of those, you'll find our channel, find our content. Normally, YouTube's good about pulling up our latest videos, latest live streams.
I think we've beat all the other Justin Brocks out. So
we have. It took a while. There was a professional skateboarder named Justin Brock, but, you'll still see some remnants of him in there. But
I'd never heard of him, but apparently he was pretty popular. He was in lots of magazines and beating us in SEO for a while, but finally we've overtaken him.
Yeah, turns out you can sell insurance longer than you can skateboard professionally. So
you chose the right one. He chose the wrong career.
Yeah, it's kind of not great on your joints, skateboarding. Of course, I did see Tony Hawk. Okay. I did see Tony Hawk doing some pretty crazy stuff the other day, and he's got to be in his late 50s now.
Yeah, he's got to be 50 years old. I mean, we were playing Tony Hawk's Pro Skater, 20 years ago. Yeah.
So, definitely 20.
And he was older then.
Yeah.
It wasn't like he was some spring chicken out there,
Yeah, he was popular. One of the more senior skateboarders at the time. But he's still doing awesome. He's got some of those Johnny genetics that was real skinny. Johnny will be doing that stuff when he's 50 years old. So, well, guys.
A fun fact, Sid skateboards.
Sid is a skateboarder. He's a skater boy. He said, "See you later, boy." So I hope that we have provided some value today. If you guys want to see us do more YouTube lives, please put in the comments, go live, right? Go live down there, and then we'll know that obviously it's something that's desired. And if you have any topics for us to talk about or cover, like how to build an agency. Somebody asked me how to build an agency from the ground up the other day. And like I had said before, it's a little bit confusing because basically you have to go out and you have to create activity and you do have to chase the revenue at first. And then as the revenue comes up, you just chase where the opportunity lies. You find out what the consumer needs, create what the consumer needs, and you go. Whether that's the consumer agent or the consumer, actual Medicare beneficiary. So thank you, Kirk. We'll do
all the way from Vancouver, Washington. We appreciate you giving up the Memphis Grizzlies.
That's right.
We thank you guys for that.
We're absolutely enjoying the Grizzlies down here. Occasionally, we wear the Vancouver jerseys. So.
I do like the throwback jerseys.
The color scheme was better. I wish we could just.
It's funny because 20 years ago, when you looked at that jersey, it was like, God, it's so ugly.
Yeah.
Now that it's retro and it's throwback, it actually looks good.
I love it. Yeah, my kids have a Vancouver Grizzlies jerseys.
Yeah, I love that the Vancouver with the old bear on there.
Yeah, definitely. Well, I hope you guys will subscribe to our channel. Please like this video and comment to help us get more traction and get more people on here, because the conversation in the chat really helps this go.
Yeah, it helps you engage with us, helps you stay connected.
And helps us think of other things to tell you that are important, because we got a lot going on over here, guys. We are really pumping out, websites for people. We're really doing a lot of marketing support for our downline entities, as well as for agents that aren't necessarily affiliated with us hierarchically. And we're learning a lot in that process, learning a lot with our agency actually going out and doing direct-to-consumer marketing. And so we like to say, and this is haven't perfected this, but we're actually putting the marketing back in field marketing organization or independent marketing organization or national marketing organization. One of the problems we see is most of these NMOs, IMOs, and FMOs only know how to market to agents, and normally they don't even do that very well. And so we're trying to put the marketing. How do you market? How do I get in front of people? How do I become the resident expert in what I'm actually trying to sell? We know how to do that because we've done it. We've done it to agents and consumers, and we want to show you how to do it, because what's going to help you is not having the biggest IMO. It's having the one that can help you grow an actual agency, because you're not trying to be the biggest IMO right now if you don't have 100,000, 200,000, 300,000, $1 million in revenue, yep. 3 million in revenue, 4 million in revenue, 5 million in revenue. You can't skip to being, an acquisition firm, or an insure tech firm, as some of these groups. Look at this. Look
Marketing's
this up,
the biggest
guys.
part of all that.
Look at this up. Like, if you look up some of these biggest IMOs, I'm not going to name them, but if you go look up the biggest IMOs you can find right now, they call themselves insure tech. Okay, insure tech. We'll try to figure out what an insure tech company is. When I think of an insure tech company, I think of one that goes direct to consumer, right? I think of a software company that services the insurance market, right? So they're not really FMOs or IMOs anymore. We have insure tech platforms. I don't know. I guess you could call us an insure tech platform. We're not really, though. We want to serve the independent agent community in any way that we can.
Yeah, I like the first tagline. Bobby Brock Insurance, putting the marketing in field marketing organization.
One clap.
Okay. That would have been better.
No, that works.
That works. Boom.
So, well, thank you guys for watching today. We hope that you enjoyed it. If you want to get any more information for us or take part in anything we're doing, please reach out to will@mcgurus.com.
If you want to join us for an interview, be on the podcast, reach out to us. We like to
want to interview people doing really cool stuff. Yep. If you think you should be on the podcast, please put in the comments why you think you should be on the podcast. If there's somebody that you want to hear on our podcast, please put their name in the comments, because we are actively looking for people that you guys would enjoy to be on the Insurance Gurus podcast. Thank you so much for watching today. We'll see you soon.